All right, thanks a lot, Deja. Well, here at 41 Action News, every Tuesday and Thursday, we are joined by an infectious disease doctor to bring you the latest updates and answer your questions on the COVID-19 pandemic.
This morning, we're once again joined live with Dr. Hawkinson from the University of Kansas Health System. So, doctor, as always, thank you for joining us this morning.
Thank you.
A lot of classes starting after Labor Day now. A lot of districts said they're going to push back. Will delaying classes have any effect? We were talking about whether this could make a difference or not.
Yeah, hopefully it will. I mean, when the startup of schools started being discussed, that was 2 or 3 weeks ago. That was certainly a different climate, different infection dynamics than it is right now. Hopefully, now, as we heard President Trump say a day or two ago, and the message coming down from the executive office, wear a mask. You know, when you go out, do things, wear a mask. If everybody can start doing that, and the climate in the United States and the culture can change with that, and we can really start to flatten the curve again and decrease spread, it certainly could be a lot different when they are proposing schools to start now if they are delaying that. If we can continue to decrease the spread, certainly it could have an effect.
Doctor, with some schools conducting in-person classes, big question is going to be about touching surfaces. A lot of students, of course, are hands-on. And what does that likely mean when it comes to the spread of this virus?
Yeah, so certainly we know surfaces or inanimate objects, or fomites as they are called, certainly can spread the disease. If somebody is coughing or talking or sneezing and the virus gets on that, and then you inadvertently come by, 10, 15 minutes, 20 minutes later, touch it and then touch your face, your eyes, your nose, your mouth, you can certainly get it. Obviously, the biggest amount of spread is going to be the close contact. So typically that is defined by the CDC as closer than 6 feet for 10 feet or more. And that will be with a close contact. If, however, both parties are wearing a mask, say the child is wearing a mask and the teacher is wearing a mask, that will help decrease the spread a lot. So the fomites or the inanimate objects or the surfaces certainly are a means to spreading the disease, but probably not as much as that close contact, or if kids or other people are gathering together closely and they can't separate, then that is going to be the main way that the disease is spread rather than the surfaces themselves.
And Dr. Hawkinson, since we've started learning about this new virus, it seemed that children are affected differently by COVID-19. Do we know any more about whether or not they transmit it as easily as adults do? And thinking about families where they might have a multi-generational household and grandparents are at home when kids come home from school. What do we know about how kids transmit or get the disease?
Yeah, certainly you talked about grandparents being a more vulnerable population because of their age and probably the fact that they have other medical problems. So what we do know from indirect evidence that is based on household contacts that get infected after a child has it, we see that that is certainly spread less than, say, if the adult has it and spreads it to the rest of their family. So that's indirect evidence. And like you said, historically we have seen that children aren't as affected. They don't have as much critical illness or have as much need for hospitalization, but certainly they can spread it. We know they continue to produce the virus in about the same amounts as an adult as well. So we don't fully understand those dynamics about infectivity, but certainly it seems that they are less infectious than, say, even younger people of older age, say between 15 to 20. It's still being investigated, obviously. It certainly goes against the dogma of every other infection. We know that daycares and schools have infections spread like wildfire, whether it's a respiratory disease or a gastrointestinal or GI disease. So, we're still trying to look. However, based on that little bit of evidence, it seems like they may be less apt to spread it as much as an adult or an older child would.
Now, Dr. Hawkinson, we know so many families have questions, and we know you guys are talking about going back to school every day this week on your 8 a.m. updates. We can find those on our Facebook pages. Thank you very much, and we'll talk to you next week.